172 countries have signed up to a programme to ensure doses are equitably distributed around the world. But some of those, including the UK, have bought vaccines directly from the pharmaceutical companies. But there are real fears that lower-income nations will be left behind. I'm joined now by our correspondent, Roger Odi-Ambo in Nairobi. Tell us firstly what the situation is in Nairobi in terms of getting access to a vaccine and whether or not there will be some kind of a rollout program there.
So far, just to say, in terms of the spread of COVID-19 in Kenya, we've seen that there's been a spike in cases, and this is because of the ease of movement that was reduced by the president and asked him to ease when he asked the government to ease down the lockdown measures. But in terms of rolling out a vaccine, the government has partnered with UNICEF to come up with structures where they're able to train healthcare workers and also see how they're able to roll out the vaccine to people who need them most. And these are priority groups, and we've seen what the WHO and the Africa CDC have said, that the priority groups should be healthcare workers, because these are people who are taking care of people who are severely and critically ill of COVID-19, and also the elderly people who have underlying conditions.
What about in terms of cost of this, Rhoda? Is there an issue regarding whether or not the country will be able to get the resources to actually get hold of the vaccines in the first place?
Cost is something that has played a key role in how Kenya has accessed even the other existing vaccines. But we've seen support from the WHO together with the Global Vaccine Alliance Initiative is that once a potential COVID-19 vaccine has been licensed and approved to be used in the African continent, in the context of Kenya and many other low and middle income countries, the vaccine will cost about $3 US. And many people in Kenya have said that this is still too expensive for them to take this vaccine, because you have to remember that right now we do not know which vaccine will be used in the continent, whether it's the Oxford AstraZeneca one or the Moderna one, and all of them have to be given at least 2 doses at some days apart. So cost is still something that is still being discussed, because also Kenya has to set aside some funding to see how they're going to be able to procure some of these vaccines through the facility that the WHO has set up.
Rhoda, thank you so much for talking us through that. Rhoda Odi-Ambo there in Nairobi. Well, I'm joined now by Ros Scores, Policy Advisor to Médecins Sans Frontières. Thank you so much for being with us. Vaccine nationalism. Just talk us through the dangers of what there is regarding preferential treatment when it comes to vaccines.
Yeah, good evening. Thanks. Yeah, no, absolutely. We're very concerned about the dangers of vaccine nationalism and what we're seeing. Vaccine nationalism is a term that's kind of arisen during the pandemic, where what we're seeing is some countries putting national interests essentially above global collaboration and the solidarity that's needed to end this pandemic, and in some cases to the detriment of other countries being able to get access. So this came around because high-income countries, including the UK, EU and the US, are pre-ordering essentially more than their fair share of the available global supplies of COVID vaccines. So what we will see is that there'll be limited global available global supplies, at least initially, for any successful approved vaccines. But what we're seeing is high-income countries, like you said, going directly to companies to pre-order their doses. And what this means is that those with the deepest pockets, the countries that can afford it essentially, are booking up the limited available supply, so that there's going to be very little left for lower middle income countries. Just to take the Pfizer vaccine as an example, out of their projected available supplies until the end of 2021, 85% of that available supply has already been sold, essentially pre-booked to high-income countries. So we're really concerned about what the available supply will be for low middle income countries in this situation.
And Ros, with that in mind then, how can we ensure that vaccines are fairly distributed around the world?
Well, exactly. I mean, a couple of global health institutions have come together, as your previous correspondent was mentioning, to form the COVID Vaccine Global Access Facility, the COVAX facility, with the aim of increasing equitable distribution of these vaccines.
Forgive me for interrupting, Ros, but not everybody, as we know, has signed up to COVAX, the World Health Organization initiative. So there will be people that are falling by the wayside here.
Yeah. No, absolutely. And this is what we're concerned about as MSF. We're really concerned that the interests of high-income countries and the way that they're pursuing their orders outside of COVAX and not always engaging with COVAX is really problematic and will lead to a delay in low and middle-income countries getting access by months or potentially years. We're seeing a situation now where the UK is hoping to roll out the vaccine next week. Well, it's going to be months, if not years, before low and middle-income countries in some cases can say the same thing. So, I mean, what we really want to see is a maximisation of the available global supply so that we're not all scrambling over these supplies. We need to maximise available supplies. And to do that, pharmaceutical companies and governments need to share data and knowledge and these technologies with as many manufacturers as possible around the world so that we can scale up these supplies as much as possible.